Hello everybody and welcome to this edition of Virtual Coffee with an OSCE Educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and owner of the OSCE Accelerator learning programme. I am joined today by the lovely Beth Fincato. Beth is one of our OSCE Educator advisors. She has been teaching the OSCE for over 5 years now to literally hundreds of international nurses. So she is a wealth of information when it comes to the OSCE test, what to expect, top tips. And so we have invited her on in order to discuss today the pain assessment clinical skills station. So we always get questions across our social media about our clinical skills sessions and what to expect at this station. So Beth, thank you for joining us. Let's dive in. What can an international nurse expect to be presented with at the pain assessment station?
Okay, so hello and welcome. So for this station, you're going to have to assess a patient's pain. You have to use the PQRST approach when you're assessing it, which is written down for you in the marking criteria. It's detailed, broken down, but I'm going to go through it with you in a minute as well.
Okay, wonderful. And timing-wise, how long do nurses have at this station?
So it's quite quick, so it's 6 minutes.
It's a speedy one. It's a speedy one. Any documentation required at this station?
No, so you just need to verbalise that you're going to document it. You'll also be given a copy of the Universal Pain Assessment Tool. That is just for reference. You don't need to fill it out or anything. There's nowhere on there to fill it out.
Okay, perfect. So pretty straightforward on the documentation front. What about the equipment front?
There's no equipment really. It will either be your examiner who's going to be the patient, or you might have an actor, but it's normally the examiner. So you're just going to have a chat with them about the pain.
Wonderful. And how would you recommend that learners best prepare for this station and best approach it?
Okay, so you need to learn the PQRST pain assessment. So it's a much more detailed pain assessment than we would usually use in practice. So I'll go through it now. So P stands for provokes. So for this, you can ask, where is the pain? What causes the pain? What makes it better? What makes it worse? Mm-hmm. So these are all the things they're checking that you've asked. Q stands for quality. So ask, what does the pain feel like? Is it sharp, dull, stabbing? Is it intense? Mm-hmm. R is for radiating. So is it in one place? Does it move around? Did it start somewhere? Severity, how bad is it? So we can use the 0 to 10 scale for that. Mm-hmm. Time, when did the pain start? How long has it lasted? Is it constant? Is it starting and stopping? Is it sudden? Is it gradual? After you've gone through these, obviously you need to give the patient some advice and reassurance. So acknowledge their pain, reassure them, ask them if they've taken any analgesia or pain relief, and tell them you're going to discuss it with the doctor and come back again and reassess them. That's all in your marking criteria.
Wonderful. Any common reasons for mistakes or fails at this station?
So commonly it's missing out one of these PQRST or not stating the appropriate intervention. So all of those things that I've listed just now, we need to say as our interventions we're going to complete.
Wonderful. Any top tips for this station then in terms of trying to obtain that all-important pass?
So this is quite an easy station. I haven't had many nurses fail with it. But as always, practice with your marking criteria, and you just need to learn these things that I just read out. And that's it.
Wonderful. Sounds quite straightforward, but definitely helpful to have it all concisely summarised like that. So thank you so much, Beth. Really appreciate you joining us, and we'll speak with you again next time.
Okay, and good luck with your exams, everyone.